Bag technique. Special considerations in the use of the bag. The bag should contain all necessary articles, supplies, and various equipment which may be used to answer emergency needs. The bag and its contents should be well cleaned as often as possible. Supplies replaced and ready for use at any time. The bag and its contents should be well protected from contact with any article in the home of the patients. Consider the bag and its contents clean and or sterile, while any article belonging to the patient as certain contaminated. The arrangement of the contents of the bag should be one most convenient to the user to facilitate efficiency and avoid confusion. Hand washing is done as frequently as the situation calls for, helps minimizing or avoiding contamination of the bag and its contents. The bag, when used for a communicable case, should be thoroughly cleaned and disinfected before keeping and reusing. Steps or procedures.
So today we're gonna perform the bag technique. So the first thing to do is put in mind that the station bag is clean and the external environment is contaminated. So to prevent contamination towards the station bag, we need to place a paper lining and a plastic lining on a flat surface just like this table. So the first thing we need to do is place a paper lining. Then we'll place the plastic lining. Now to provide a clean space for the station bag, we will now place it on the left side of the lining. Now, we'll request for two basins, which contains clean water. It is important that we ask for two basins since we need one for performing hand washing prior to the procedure and another one for performing hand washing after the procedure. We also need to place the basin on a separate space from the workspace in order to make sure that the workspace doesn't become wet. So now that we have prepared the basin, we will now prepare the necessary equipment for hand washing. So we'll now open the bag. So we'll place the straps on the sides. So now open the bag. So now we'll get the soap dish, the hand brush, the clean towel, and the apron. So after getting this, we need to close the station bag but not completely lock it. It is important to close the station bag in order to prevent contamination. And we must only open the station bag for 3 times for getting the hand washing equipments, for getting the nursing procedure equipment, and for cleaning up, which requires the returning of the used equipment. So since we have the necessary material used for hand washing, we will now perform hand washing. So it is important to perform hand washing in order to prevent the spread of infection towards the patient. So after performing hand washing, we must pat dry with a towel. So after performing hand washing and patting dry our hands, we will now place the apron. And we must observe a proper technique. So we'll do this by placing the apron right side up. And we'll tie the sides. Placing it. And after placing our apron, we will now open the bag and get the necessary materials. So for this nursing procedure, we will perform wound dressing. So open the bag. And for wound dressing, the materials we need are alcohol, betadine, cotton, micropore, a wooden cotton applicator. We also need a bandage scissor, but since we don't have, we'll use a heavy forceps and glove it. We also need a kidney basin and And for later on, we will use 2 muslin bags. So we also need a base receptacle. So we need to make sure that these materials are within the clean lining. So we'll now close the bag. And afterwards, we will now perform the procedure or the nursing care or treatment. So after performing the nursing care or treatment, we will now clean the used articles. So we'll use alcohol in this. It is important to sterilize all the equipment in order to prevent the spread of infection. So after sterilizing the equipment, we will now perform a hand washing. So this time, we will use the second basin. So it is important to perform hand washing in order to prevent the spread of infection towards other clients. And after performing hand washing, we will now pat dry our hands and return to the work area. So now, we will return the articles that can still be reused. So we'll open the bag and return these articles that can still be reused, such as the alcohol, the betadine, the cotton, the wooden cotton applicator, the micropore, as well as the dish soap. And now we will close the bag. And for the other solid equipments that have been used, we will place them inside one of the muslin bags. So we'll place it inside, such as the kidney basin, the hand brush, and the bandage scissor. So place them outside this deep clean area. And after placing the used equipments, we will now perform the removal of the apron. So we must also observe a proper technique. So we'll start by removing the neck portion of the apron. Then we will fold it, making sure that the soiled areas are the ones touching. Then we will place it inside one of the muslin bags. In this bag as well, also place the towel. And now, we will carry our bag and tie the muslin bags. Now, we will also get the plastic lining and place it inside the bag. So let's make sure that the soiled areas are the ones touching. After this, we will dispose the eraser supply call as well as the paper lining.
Record visit. Make post-visit conference on matters relevant to healthcare, taking anecdotal notes preparatory to final reporting. Make appointment for the next visit, taking note of the date, time, and purpose.